All right, welcome back. Let's all gather in. Very excited for our headliner today, Jess Langerud. Again, welcome back to the Clean Talk platform at the Seal Shield booth here at HIMSS 26 in Las Vegas. We're thrilled to be here. We've had some great guests over the last couple of days, and we saved the best for the last one on the second day. And so Jess is here to talk to us a little bit about the things he's been doing at UC Irvine. And I'll give you a little bit of Jess's background. I'll be honest, his bio is pretty extensive. So, Jess, thank you for being on Clean Talk today here at HIMSS. Jess Langerud is the Principal Project Manager at UCI Health with more than 26 years of experience spanning clinical practice, healthcare technology, digital transformation, and military leadership. Jess has built a career at the intersection of patient care, operational excellence, and enterprise-scale healthcare innovation. Previously as Director of Transformational Technology at Providence St. Joseph Health, Jess led telemedicine expansion during the COVID-19 pandemic, onboarding more than 2,000 providers in less than 3 weeks while ensuring HIPAA compliance and operational continuity. You did that?
Yeah, let's not do it again.
All right. During his decade at Kaiser Permanente, he held roles including Clinical Director of Emergency Services, IT Service Area Manager, and Business Transformation Leader, directing emergency department operations, advancing digital workflows, improving patient throughput, and standardizing clinical protocols to achieve full regulatory compliance. Jess's early career included leadership roles in trauma center planning, pediatric emergency service, and Epic EMR workflow design. In parallel, Jess has served in the United States Army Reserve since 2008, currently at the rank of Lieutenant Colonel. Thank you for your service.
Thank you for your support.
He has commanded large civil affairs units, negotiated international medical interoperability agreements, authored disaster preparedness policies, and directed multinational health security initiatives supporting allied forces across Europe. Jess holds a Master of Business Administration, a Master of Arts in International Relations and Affairs, Advanced Military Studies credentials from the U.S. Army Command and General Staff College, and a Bachelor of Arts in Nursing. He maintains licensure as a registered nurse and earned the Certified Project Professional designation through the Project Management Institution in 2025. And weren't you Man of the Year in Southern Cal?
Yeah, something like
This is
that.
a special guy.
Yeah.
Please welcome Jess Langerud to the stage. Thank you.
Thanks, everybody.
Thank you,
Appreciate
Jess.
it. Yeah.
So, Jess, thanks for being here today. How'd you find your way into healthcare project management?
Why? There's been no planning in my career. It's all just been serendipity. One good opportunity led to the next, and then just being smart enough or crazy enough to say yes to an opportunity. And yeah, so I went from clinical nursing to IT and now capital construction.
What led you into nursing in the first place? Did you have a passion for healthcare, or was it?
I was interested in healthcare. I'd been an EMT when I first started, and I had no desire to go to med school. That was just too long to go to school. And so nursing seemed like a happy medium. And yeah, so I started off there in the ED, and then just kind of life just took its path.
Well, you've had a fantastic career, and I've had a chance to visit you over at UC Irvine. I know what a busy guy you are.
Yeah.
But as principal project manager at UCI Health, I mean, what does a typical day look like?
Well, so right now it's calm, right? But we just finished a sprint, a marathon of building this $1.3 billion hospital in Irvine, where one hadn't existed before, really pushed it out into, tried to push the edge for what we could do at UCI Health. We're academic medicine. We're the only academic medical center in all of Orange County. We do have some other competitors that do great job with different kind of healthcare, Hoag, Kaiser, Memorial Care, they're all there. But we're the only academic center. We're the only level 1 trauma center, and we're the only tertiary care center in there. So we're the safety net hospital as well as the academic center. The campus we just built was actually a homecoming. When UCI was founded in the 1960s, there was always an intent of having an academic medical center on the campus. But conditions being what they were in the 60s and 70s, we actually ended up purchasing the county hospital from Orange that was in the city of Orange, and bought that for $1. That became our mothership. So it was during the COVID era, the organization decided we needed to go back to our home. We needed to build a new medical center to establish a new standard of care. And so we created a 144-bed, I'm going to call it a specialty acute care hospital. A lot of neuro, surgical, orthopedics. We have a gigantic surgical mega floor. We have over 27 surgical and procedural spaces on the ground floor that then feed up into the inpatient care up above.
Well, it's an amazing facility, and I will talk more about UC Irvine and the good work you're doing over there with them. Um, just curious, you've had leadership roles in the military and in healthcare. Maybe what's something your team would say about your leadership style that might surprise us?
Um, I think the way I like to work with people is through influence. I don't want to tell somebody what to do. I don't want to give them the answer. I want them to help discover the answer with me. Um, and I've heard people say that I don't think outside of the box. It's just there not isn't even a box.
I
We
like
just
that.
go where we want to go.
That
So
resonates with us here at Seal Shield as
yeah,
well.
doesn't it though?
Yeah,
And I think it's why we've worked together since I was at Kaiser.
that's right.
And your products, and we've just brought them wherever we've gone. So it's been a good partnership, and I think there's a lot of synergies with that.
Well, I agree. And actually, it's missing in your bio, but I think the most notable is that you're a founding member of Seal Shield's Healthcare Advisory Council.
Yep.
We certainly thank you for your tenure. It's been a long time.
It's been what,
Well,
15 years or more.
15
Yeah,
years. Yeah.
it's been
Wow.
great.
It's been fantastic. So, what's your philosophy on IT? We're an infection prevention company.
Right.
You're an IT guy.
Yep.
So, what's your philosophy on IT's role in infection prevention? I mean, is it mandated from the top? Is it driven from the front lines? What is the connection?
I think it's a blend of the both, right? The technology that we put into the space, and there's a couple of slides here that show some of the stuff that we put out there. I mean, these are the surfaces that people are touching all the time. It's probably a number one potential vector for transmission cross from one person to another person, patient to patient. And they're also really hard to clean, right? Look at all those cracks and crevices, and then everything else that falls in it, drips in it, gets into it. So you have to pay attention to it. And then the other thing I appreciate about the different products is the multiple form factors, because there is no one single form factor that works for everybody.
Sure.
The picture with the white desk there is this crazy tea table that my surgical teams invented and fell in love with, but it literally had like a desktop surface that was so tiny that we went through like several different keyboards, and this was an early iteration. We actually ended up going to even one of your smaller form factors to make it more ergonomically acceptable, and to be able to do what we needed to do in that surgical space.
Well, we work with a lot of healthcare facilities and a lot of IT departments.
Mhm.
And I think it's refreshing that you really do have that global look that includes infection prevention. But not all IT departments look at it that way. It's the whatever the lowest cost IT solution is. And is there something that's
Right.
core to UC Irvine, or is that your initiative that you take on the responsibility of infection prevention within your role in IT?
Well, I think we take it on when we do capital construction, right? A lot of IT people, the desktop folks will tell you, well, it came with a keyboard. What's wrong with that keyboard? Why am I replacing the keyboard that it came with? And it's because, well, that keyboard was meant for a multitude of other spaces. The hospital we built, it's probably one of the most complex structures that humans design outside of nuclear power plants.
It is amazing.
But you don't ever invite the public into a nuclear power plant, right?
Mm.
So this is a public space, the amount of regulation that we have to work within, especially in California, is just tremendous. And so if I can reduce risk in some areas by putting in specialty devices, it gives us our own ROI on the back end.
I agree, and I love that you recognize that. And based on that, what are some recent initiatives at UCI that you could talk about?
Well, so with the capital construction here, the red keyboards, we put those out on all of our BCA devices, our business continuity devices, to make them easily recognizable. One of the issues that we found with it, with some of our other deployments, some of our other locations, is how quickly and easily can staff identify where their downtime computer is? Which one has all the patient information when the network isn't working, or we go into downtime or wherever else. And that red keyboard just jumps right out at you and says, I'm a little bit different. You use me when in an emergency. This is where you need to go. And so that was a big one for us. The other form factors we used were your keyboards on our wows, as they're moving around and trying to be able to do that. Like I said, the smaller form factor. I should know the keyboard's names better, but I don't.
That's all right.
So
I think you're using
the one
Clean
that's
White
the really
Pro.
flat one. That one's my favorite.
Okay.
We put that in all of our surgical areas. And then we even use some of your other devices in our compounding pharmacies, because they
That's
have
right.
even more requirements
Right.
for what work surfaces have to go in there and what equipment looks like
Right.
and things like that.
Contamination issues.
Yeah,
there.
yeah. So,
Of course.
yeah.
So I understand, we're partnered with a lot of the cart manufacturers, wows. There's a lot of them here at HIMSS 26. But you've been doing some transitions away from wows, more
Yeah.
towards stationary arms. Can you
Yeah.
talk about why that's happening?
Yeah. So our hospital, we ended up getting LEED platinum. And a part of how we were actually able to achieve that was by taking batteries out wherever we could.
Mm.
Batteries just crush the math on trying to get your LEED certification. So by going away from wows, I reduced the cost structure. We used more PC mounts in the rooms, which again gets the caregivers closer to the patient. You remove a monument, and most wows, admittedly, don't move once they're
Okay.
placed, right? They grow roots, they stay plugged in. Very few get moved from place to
Interesting.
place, especially if you have multiple wows. And we have computers everywhere. I think this hospital, we had close to 900 computers throughout the building
Okay.
for a 144 bed hospital.